Hi, my name is Rachel Taylor. I'm the fall specialist nurse at Great Western Hospital in Swindon. For older people, falling is a real risk. So about 1 in 3 people over the age of 65 and about 1 in 2 over the age of 80 will fall about once a year. And that risk continues as people are admitted into hospital. Falls are not an inevitable part of ageing. There's lots we can do. There's a massive impact really on people. So it may be no injury, but loss in confidence, social isolation if people feel more nervous about going out, the mental health impact of that. So the theme of Falls Awareness this week is about keeping active, keeping moving, keeping well and keeping good muscle strength. So that is the same for people in their community setting, in their own homes, getting out, getting active. And then for patients that come into hospital, often traditionally patients have come into hospital and felt that we need to have bed rest as you're getting well, but actually once people have got over the first stage of their acute illness and are more stable, then the message really is to get people up and out of bed, getting dressed, making sure that they've got their glasses and hearing aid if they use those, encouraging patients to eat well and stay well hydrated, walking to and from the loo when they can, and making sure patients got their correct walking aids. Some of the really small things we can do is making sure that people have their own clothing coming in from home where possible, and some well-fitting footwear. So traditionally we've encouraged patients to wear non-slip socks in hospital, but actually we know that some good well-fitting footwear, slippers or shoes, does support the foot and supports balance and reduces the risk of falls. If we can contact relatives, family members to bring in some footwear from home. And for those people in need that may not have anybody to contact or may have financial problems, we do have a small supply of slippers in the hospital to provide to patients. And so some of our wards are doing some work on footwear, some are working on using sensor mats and technology equipment and bathroom alarms. And some teams, for example, are working on multidisciplinary team debriefs after falls to try and bring the whole team together. So I think the one message to take away from Falls Awareness Week is about always assessing the risk of falls for your patient and trying to minimise those risks as much as possible for that person. Trying to encourage mobility as much as possible to keep active, because actually that in itself in the short term and in the long term reduces the risk.